Fluency is not intelligence. These systems that sound incredibly convincing, but sounding right is not the same as being mechanistically correct. In science and healthcare, the field where I come from, being approximately right can be incredibly dangerous for obvious reasons. A fluent model can produce a beautiful explanation of a disease pathway that doesn't actually exist biologically. I mean, how many of us have typed a prompt into ChatGPT and have it spit something out that sounds great, and we even find ourselves convinced that this is correct without even thinking to do some research and a little bit of digging. Real progress in AI for science isn't about generating better summaries. Better summaries isn't going to solve disease.
Welcome to The Edge of Show, your gateway to the Web3 revolution. We explore the cutting edge of blockchain, cryptocurrency, NFTs, ordinals, DeFi, gaming, and entertainment, plus how AI is reshaping our digital future. Join us as we bring you visionaries and disruptors pushing boundaries in this digital renaissance. This show is for the dreamers, disruptors, and doers that are pumped about where innovation meets culture. This is where the future begins.
We're expanding across new frontiers, streaming on Zora and Rumble. On Zora, creativity lives on-chain where every post, drop, and idea can evolve into something of real value. Explore what we're building on Zora at Zora.co. And on Rumble, you'll find the space where creators connect freely and conversations grow without limits. Catch our episodes and join the discussion on Rumble at rumble.com. Just hit either platform and search The Edge of Show to find us. Two communities, one mission building the future together.
Hi, everyone, and welcome to this special edition of The Edge of Show. This episode is co-produced in collaboration with BeyondTheCode.ai, bringing together leaders shaping the future of decentralized intelligence and AI-driven innovation. I'm your host, Josh Krieger, and today I'm joined by my special co-host, Nefertiti Strong, co-founder of XRagency.co and founder-director-producer of BeyondTheCode.ai. Nefertiti, it's great to do this show together. It's one of a series of shows we'll be doing together. Nice to have you here.
Thank you so much, Josh. Super excited to be here at Edge of Co. I'm a huge fan, so very excited to be a part of it. And thank you all for having us. Today's show features Kennedy Schaal, a really good, amazing person. Kennedy is the founder and CEO of Rejuve.bio. Kennedy Schaal is a leading biologist and biotech executive with nearly 20 years in longevity research spanning evolutionary biology, genomics, and neurobiology. Her work spans genetic aging pathways, cognitive enhancing compounds, and disease models. Today, she integrates AI with multinomics data and at Rejuve.bio, advancing precision longevity medicine and building decentralized AI infrastructure for scientific discovery.
Kennedy, welcome to the show.
Thank you so much for having me. It's really an honor to be here.
Yeah, it seems like there's nothing anyone wants to talk about except AI. It's everywhere right now, and much of the focus is on content generation. From your perspective, what's being misunderstood about real AI progress and how it applies to science and healthcare?
What's being misunderstood, in my opinion, in AI as it's applied to science and healthcare is that fluency is not intelligence. We built these systems that sound incredibly convincing, but sounding right is not the same as being mechanistically correct. In science and healthcare, the field where I come from, being approximately right can be incredibly dangerous for obvious reasons. A fluent model can produce a beautiful explanation of a disease pathway that doesn't actually exist biologically. I mean, how many of us have typed a prompt into ChatGPT and have it spit something out that sounds great, and we even find ourselves convinced that this is correct without even thinking to do some research and a little bit of digging. But if we bother to do that, we actually find out that it's full of crap. Real progress in AI for science isn't about generating better summaries. better summaries isn't going to solve disease. But structured reasoning over multimodal biological data, genomics, transcriptomics, proteomics, phenotypes, all the omics, and identifying causal structure and not just pattern similarities. I think we're overvaluing fluency over understanding in this regard. And I think we should be rethinking the assumption that bigger models, like just scaling these neural nets forever and ever, will automatically translate into better biomedical insight. So in biology, like correctness beats creativity every time, in my opinion. So
That makes sense. So I'm a biohacker, I guess. I'm using peptides, and I just got stem cells and exosomes implanted into my body. And I definitely did a lot of research using AI. Was that a bad idea? Because it did convince me to become a human experiment for the last 3 months.
um, did you consult with a physician first?
I did. I took like a
Okay.
hyper approach, but I definitely leaned forward after sort of a lot of introspective conversations with AI.
Okay. I mean, there is definitely, a right way and a wrong way to use AI. You can feed back research that you find back into it. And as the models have gotten better, they do have the capacity to remember. And I mean, as long as you are, consulting with somebody who has actually studied medicine before you do this stuff, you know, then yeah, I mean, just don't be stupid about it. I mean,
Yeah,
unfortunately, yeah,
I
unfortunately.
didn't order the stem cells and implant them myself, and I didn't have
Great.
need to do that.
Great, yeah. I mean, unfortunately, I don't know if you read in the news, but there was an incident in the longevity community at RadFest last year in Vegas, which my one of my dear friends and mentors, Aubrey DeGray, and also a good friend Dave Wood, are now involved in sponsoring. Last year in Vegas, they had like an on-site clinic where there was a doctor who did inject two people with peptides that were unnamed and untested. And two women actually did end up going to the hospital. Um, so, and even now, like, people, obviously, my husband's actually a peptide specialist at Keck Medicine at USC. And, we tried to find out like what peptides were, and there's nothing on the website and everything like that. And, people hear peptides and they think they're just, kind of these innocuous things. It's just, but no, there's trillions of them, and there are proteins that actually, proteins are the things that are very active in your body that literally make things happen. So you should just be like injecting them willy-nilly. So as long as you're under the guidance of something, then yeah, of course. I mean, and there's a right way and a wrong way to use AI, like so.
Well, Kennedy, when you talk about moving AI from prediction to structured scientific reasoning, what actually changes in how discovery happens?
So there's a pretty big difference between prediction and reasoning. I mean, they do work together, but they're different. Prediction tells you what is likely, and reasoning tells you why. That shift changes discovery fundamentally. And instead of saying this gene expression pattern correlates with disease, we can ask, what is the causal change? Like, which transcription factor regulates which pathway? What compensatory networks activate? Causality means that you can then intervene. So like if I like, perturb this particular node, does the disease phenotype change in any way, or does the observed phenotype change in any way? A trustworthy AI generated hypothesis for a disease intervention would need three things: a statistical signal, biological plausibility, and cross data set reproducibility. If that hypothesis fails at any one of those things, it would be interesting, but not actionable from like a disease intervention state. So we have something that we call in biomedical research that we refer to as the translational valley of death. And what that is the effort that it takes, the Herculean effort that it takes to get from a benchtop in a lab into a human being for a therapeutic. And that is where 95% of drugs fail. And it's, you might have a target in mind and everything looks good in your initial testing. It looks good in vitro in your petri dish. It looks good in vivo, which is in your mouse or your rat studies. But you get to a human and for whatever reason, it doesn't work. And that's where you find out like, oh, we are actually targeting the wrong genetic variant, or sometimes it's the wrong gene altogether. It's actually, a gene next to this gene that's in influencing its expression. And that could be, in some of these generative AI tools, it might have, indicated that you were on the right path, but maybe not. Because they're kind of black boxes. So there was no way to actually know what the mechanism of action was that you were supposed to be targeted. A reasoning layer, like what we've built, would solve that. So you would know from the beginning the actual mechanism that you're targeting, and you would have a much higher chance of getting across that valley of death and knowing that the actual target you're going after in those poor little mice and rats who have sacrificed their lives and that are very expensive to use would actually translate into a human being. And my hope is that all this AI and this advanced research will actually remove the need for those mice and rat studies, because they're not very accurate anyways for how expensive they are. And it's cruel and unusual. So a reasoning layer would actually improve the accuracy of that. I mean, for all the promise that these generative AI tools have held in biomedical research, we should have really had an AI generated drug by now. And I mean, there's some in human trials, but their readouts really aren't as good as they should have been. And there's a lot to be said for mechanistic causality and keeping a human in the loop to update those rules.
Well, so talking about humans, I mean, you and I were both just a part of the African Tech Summit, or the Cardano African Tech Summit in Nairobi. And you had a chance to work with Emilian Popa, who's a, biohack, I mean, all of the above. And, you were able to get together with him to talk about data and human data. What does that look like for you after being in Nairobi, seeing the amount of data that you've now been exposed to and the level of healthcare that doesn't happen? How are you able to use that data?
So being in Nairobi was an amazing experience. And I'm so happy I had the opportunity to go. I can't wait to go back. Over the last week since I've been back, I've kept in touch with many of the people that I met there. I actually was on the phone this morning with a group of people that I met there advising on their startup. And so one of the things about the data coming out of Nairobi, we need to build data networks that maintain sovereignty. It's a very important corridor because the future of AI-driven health cannot just be built in places like Silicon Valley or Palo Alto or Boston. Like, we're not only are we going to get really terrible homogenous health models. I mean, that's one of the reasons with some of the health AI that we have now is that the data that they're trained on come from very specific groups of people. And I always say that one of the paradoxes of personalized medicine is that to understand one person really well, you have to understand everybody really well. And we all have African DNA. And that is a huge chunk of data that is missing in these health models. But of course, we need to have a solution where the data can stay local to these governments and to these people, and it can stay sovereign, but the learning can be shared and the learning can travel. And there is a really amazing thing happening in places like Nairobi and around Africa. They are building digital rails faster than many legacy systems. And decentralized identity, mobile first healthcare, and open data networks have a really good chance to mature there. And they have this kind of ability to potentially leapfrog this institutional inertia we see in the US and Europe. And so they really could lead the charge to, something like a blockchain-based soul-bound token, like EHR system of like health data that follows you everywhere, that you can, contribute your data to research and be incentivized to do that through, profit sharing for, the creation of blockbuster therapeutics that are then created, or some share of IP or what have you. And also keeping all of your health data in one place, which, I mean, for anybody who's ever had to like take care of like an elderly parent or somebody and has had to go across town to like different doctors and collect all their stuff and put it all together, I mean, that would be amazing. And that's something that like a place like Nairobi, who's already like has all this like digital infrastructure like already down and growing, and has the mobile like, you know, stuff on hand, like something like that could really really explode there, and they could lead the rest of the world in that system.
That's a pretty incredible opportunity I wasn't aware of until you shared it with me. I didn't have the luxury of going to Nairobi. I wanted to be there with you guys, but
It was awesome.
But yeah, I mean, that's been a conversation since I started the show in 2021, in terms of, and before that, in terms of what could be done with on-chain health records, right? And I guess I've always felt like the regulatory climate in most of the world is not conducive to this possibility. Are you, just to clarify, are you saying that that the government is supportive of this type of idea as well? Because that feels pretty essential for this to happen.
In Nairobi, I actually don't know much about the government support for this. I wouldn't be surprised if they were. Neff, do you know much about how the government?
I would say that things are evolving, and when you look at the regulatory changes that are happening, even in Accra. I mean, Accra, there was a law that was just passed whereby cryptocurrency is no longer illegal. So I think what's happening in Africa, especially in what they're calling the Silicon Valley of Africa, the United Nations is there now, more prominent. They've been there, but they're more prominent. I think people are waking up to understanding that Africa is not a place that's just been discovered. It's a place that has functioned. It has loads of scientists and scientific discoveries, including a lot of architectural discoveries. And then when you look at crypto and all of the companies that have come out of Africa, like Kennedy and like all of these different, developers, M-Pesa, for example, that trades more than, actual whole countries in a day. I think things are evolving, and I think it's people like us that get there, get on the ground. It's shows like Edge of Code that give us the outlet to allow people to understand exactly what's going on in these regions. So governments will catch up if they aren't already in progress.
That makes, yeah. I mean, I'm always going to be cautiously optimistic when it comes to conversations like this, because I didn't think this idea of like titles on the blockchain was going to actually happen, and the California DMV did it. So things are progressing, and these stories are happening every day. They're not in the headlines, so to speak, which is why we're having a show like this, and appreciate your time. Going back to the conversation around AI and actual medical advice and personalized medicine, there's obviously the risk with AI of scaling errors that do occur based on, for example, the data gap you mentioned. I wasn't aware that all this data around African DNA wasn't readily accessible. So I guess the question in my mind is, what is it going to take, and in terms of effort and time and collaboration, to build trustworthy scientific systems, not just models that say cool things?
Yeah, so that is a big issue. AI can be, science itself has a self-correcting nature, um people, scientists, there's been time for we get kind of lambasted for, having scientific opinions, but a good scientist, like, will change their opinion in light of new evidence, and be self-correcting. But AI has a tendency to amplify error. And so to build a trustworthy AI system, you generally need three things. You need structure, constraints, and you need adversarial validation. So you need, validation against things that don't necessarily agree with what you're trying to prove. And most teams cut corners in three different places. They train on noisy or biased data sets. Like a lot of like AI health systems right now are trained off of like NHANES or UK Biobank and stuff like that. I mean, it completely cuts out a lot of the global south. So you have to take your AI health advice right now with a lot of grain of salt. They don't separate training and evaluation domains properly. They don't validate against experimental ground truth. So like your Gen AI systems that are trying to do science, there really isn't a mechanism for them to iterate along with a scientist in like real-time wet lab experiments. Like it can't really do that. So our internal bar at Rejuve Biotech is kind of simple. It's like, would we kind of ask this question, would we spend real lab money testing this hypothesis? And if the answer is no, it doesn't leave the system. And so trustworthy systems aren't built by, like I said, scaling neural nets forever. They're built by constraining them with biology. And so, we've built like our platform's a reasoning system. Like the LLM that we use is really just a chat interface. It's a secretary. You can use it to ask questions about the graphs that we produce with our reasoning system. And so, that allows the scientists to iterate on hypothesis, go back to their bench, do their experiments, put the information back in, rerun the system, see if it comes back out with any more additional information on the mechanism of action. Has it updated its opinion in light of this new evidence? It also generates reports. It's not a black box. It doesn't just spit out random rankings with no explanation for why it thinks the way that it does. And so that makes it very different from just like some neural net that's just going to give you a pattern. So yeah, so those are like some of the risks that we're trying to mitigate. So yeah.
So when AI health data and decentralized systems converge, ethics get complicated. What governance structures actually work in that environment, Kennedy?
Um, in my opinion, governance really needs to be layered. Um, I think data ownership should remain with the source, whether that's the patient, preferably the patient, or the institution that's, um, hopefully collectively, governed by patients. Model governments should be transparent and auditable at all times. Um, Outcome governance, I think, should be shared where value is created. I mean, I think this is all something that, I really have a lot of hope in blockchain as a solution for a lot of this. I really hope that blockchain-based um, electronic health records become a thing. I mean, I certainly want to have it on. I certainly have it on my roadmap for our clinical applications. Um, Consent at scale means like programmable consent, like granular, revocable, purpose bound, like that anybody can opt in, opt out at any time. Anybody can audit like what's being done with their information at any time. What doesn't work in governments is opaque foundation models trained on scraped biomedical data with no attribution. So basically, like, what 23andMe did, like selling everybody's genomic information that like they paid to have them do to the highest bidder. Um, if AI is going to transform healthcare, it must be accountable to the people whose biology trains it. I mean, we're entering into a world where data is the new oil or data is the new gold. Like, we might be in a situation here where, we will be in a situation here where like AI is, where data is the most valuable thing that you have. Like your data, your personal data. It's hugely valuable. Somebody just asked me the other, yeah, because I have one of my partners and I were putting together like a bio performance platform for athletes, and he was trying to do like the valuation of the company and stuff, and he's like, I'm trying to put a number on bio data, like how valuable do you think it is? I'm like, it's priceless. And he kind of laughed and he's like, yeah, I know that's your opinion on it. I was like, no, it really is. But and I actually did ask Gemini, which is Google's thing, like what would you value at it? Google would value at like $500 billion was the estimate, was for the biodata marketplace by like 2027, I think is what it put it out at. So yeah,
appreciate all that context, and having someone with your background sort of unpack this for us is really valuable. We've been talking about sort of the problems with sort of centralized healthcare data and the challenges of sort of getting decentralized data to become a reality. There's political silos and other regulatory complexity. Why does decentralized infrastructure matter in a practical way to the future of modern medicine?
I really don't think healthcare data should live in one place. A really big bottleneck isn't model performance, it's data access and trust. Hospitals don't want to surrender control, and patients don't want their data extracted without benefit. Countries don't want biological sovereignty to be compromised. Decentralized infrastructure allows computation without centralization. So like I said earlier, like the data can stay local to the location, and the learning can travel. So you can collaborate on insights without pooling raw data. So there's even like techniques, there's fully homeomorphic encryption. So all the data, can stay encrypted, and, people around the world can still compute on it, can still do research. On blockchain, exactly what's been done with that data, where it's gone. And so people can be incentivized or compensated for the use of that data. Researchers can even contribute their research and have maybe a share in IP on what's been created with their research, and as far as like therapeutic development or what have you. They can track it down when time comes for patents to be issued, or whatnot. And it's really, in my opinion, like the only way that global scale biomedical AI becomes viable. And I really think I think it's a really great way forward to not only enjoy the pace of medical advancement that we have up until this point, but increase it. Like we could do better. Especially, we're all I think we're all you're American, right, Josh? Like we're all American. Or are you Canadian? We're American.
Yeah,
Right?
I'm
Yeah.
American. I haven't
Yeah.
spent too much time there the last year.
Yeah.
Yeah.
Yeah. So I mean, we've had a lot of medical advancements in this country. We've funded a lot of medical advancements around the world and stuff. But sadly, you know, that system's been gutted over the last couple of years and stuff. And we're at a crux here where a lot of that is being taken away and stuff. But if we have like a new system of decentralized incentivized research around the world, and we become global citizens in this regard and global researchers and stuff, like we could actually move a lot faster and we can solve a lot of these problems a lot faster. And nobody, and if people want to keep data people, there's an opportunity for people to keep data private, to retain their own IP and still collaborate in research and share research, and still benefit in a monetary sense for themselves.
That
So.
that definitely resonates with me. And just today I was looking at just temporary healthcare plans in Colombia, and I think I'm paying $800 a month for my own healthcare in the US, which is full of loopholes and caveats. And I got a quote with no loopholes and new caveats for a very comprehensive plan for $200 a month.
Oh my God.
And I was just like, it created a moment of pause and reflection with what is going on. And I have to say the quality of healthcare in Colombia that I've received is very high. The educational standards are very high. The sophistication of doctors and their due diligence is very high. So it's just an interesting moment we have, where I think this idea that you shared earlier on the show about how we can incentivize data sharing by rewarding individuals. I remember at ETH Denver last year, a company that was letting you swab your DNA and sort of had a whole model for, sharing your DNA in an encrypted, sort of anonymous way, but still getting rewarded for sharing, with the scientific community. And I do hope projects like this succeed for the betterment of the quality of data, and to sort of support the Own Your Data movement, which of course folks like Brittany Kaiser have been
Mm-hmm.
voting for a very long time. So
Mm-hmm.
yeah, so a lot to think about there.
Mm-hmm.
Yeah, it's interesting because a lot of companies say they're building platforms, but they're really building apps, right? We've all experienced that. I would love to know, Kennedy, where Rejuve is placing its bet in the stack.
Yeah, that's a great question. Apps solve use cases and platforms shape ecosystems. That's kind of the way that I see it. Rejuve Biotech, I'd like to say that we are placing our bets at the infrastructure layer. Structured biological reasoning, multimodal data integration, hypothesis validation systems. Infrastructure is defensible because it becomes embedded in workflows, it compounds. Ecosystem growth happens when researchers, clinicians, and partners can build on top of your system and not just consume it. So we sort of become like, the bedrock, and handing people like the great picks and shovels too. Um, if you're just wrapping an LLM in a user interface, you don't have a platform. You have a feature. And we are actively working as the infrastructure layer for not only our AI co-scientists, but several other partners. So like I mentioned earlier, we have a bio performance athlete optimization um, uh, uh, partnership with a company called Just Keep Going with my friend Kevin Fry, that we're piloting through several African countries. We met with the Kenyan Olympic Committee while I was there last week. I'll be meeting with the Ethiopian Olympic Committee when I'm there in a couple of weeks. piloting it in some of their high performance athletic facilities for their Olympic teams. And so that will provide an infrastructure layer for some of their athletes to optimize their training. We're working with another company called Alice, which will be a clinical application for longevity clinics to start, but all other clinics and by applying providing their AI infrastructure and biological age calculation for their clinics clinical decision support. So I mean, and we do also have a gifted UI developer for our team as well. So it does work well, but we are much more focused on providing good reasoning infrastructure and not just another LLM, so that people can actually have infrastructure that delivers mechanistic causality and not just more patterns. So yeah.
So let's dig into these models a little bit more and how they predict the accuracy of therapeutic remedies and lifespan, and how these hypotheses essentially translate to the real world. Is there a really high degree of accuracy at this moment, or are there impediments there?
So like the big key to that is, of course, translation. And biology by its nature is pretty non-linear. Like, mouse models lie, human heterogeneity explodes your signal. Regulatory pathways are slow. Clinical endpoints are very noisy. And generally, teams in the lab tend to estimate a few different things like delivery mechanisms, off-target effects, and patient stratification. Realistic progress in this regard looks like incremental compounding, better target selection, and improved trial design. So shorter iteration cycles. And in this regard, we can have some more informed AI models. So for we also have an issue where translating this into actual health span therapies, especially in regulation, um, uh, getting aging designated as a disease has been difficult. And so, because this, we don't like to treat things, in advance, like before they happen. We like to treat symptoms that while we're already sick, which is sort of a problem. And aging tends to really be preventative healthcare. So those are sort of some problems with like the system where it sort of tends to break.
So Kennedy, if we zoom out to like 2050,
Mhm.
what do you hope we've built so longevity isn't just a luxury? And what will we regret if we don't act differently now?
By 2050, I really hope that longevity isn't a concierge service for the wealthy. That's like number one. I hope that we have open biological knowledge networks, privacy preserving global health data collaboration, AI systems that explain themselves, that aren't black boxes. I hope that we have therapies that are priced for planetary scale, that are accessible for everybody. If we don't act now, I think that we risk building extraordinary tools that only serve a fraction of humanity, and that the divide will just get bigger. I mean, if we even, survive to see that happen. The principle that must survive the hype cycles is this: intelligence should expand human capability and not concentrate power. responsible abundance in healthcare means more life, more function, and more access, not just more valuation. Health health should be a human right. It shouldn't be a privilege. Like, I mean, it's as simple as that. Like, we all deserve to live long, healthy lives. Like, it's that simple.
Yeah, that's very well said. And I would include mental health in that sort of conversation.
Oh yeah.
One of the earliest guests on our show related to AI was Ria, a mental health android, humanoid robot, helping sort of therapists deal with patients, or mainly students and seniors in difficult situations. And I feel like mental health is an area where AI can really create massive breakthroughs, where there's this, you know, I guess I would call it a stigma attached to seeing a real therapist, a human therapist that you don't have with AI. So I do hope that as we progress with advancement of AI, that mental health doesn't get lost in the shuffle, because we're all going through major life changes with AI, and mental health to deal with this shifting society becomes critical.
Mm-hmm.
With that said, let's sort of close out this part of the conversation by just getting a little bit of an update from you on Rejuve and what your plans are for 2026 and beyond.
Well, for 2026, we are launching our AI co-scientists. So we have that will be available for benchtop researchers. We have several LOIs signed with various research institutions around the world, and here in California, also in Europe, in Copenhagen and Germany, and some biotech companies as well. We'll be piloting that for us, which is really exciting. We'll be using our reasoning layer is built on pretty novel neurosymbolic architecture, which is really, really exciting. Like I've alluded to several times throughout this podcast, it's brand new AI architecture. It's not just neural nets stacked on top of each other. Our neural net is our user interface. It's our secretary. It doesn't do any of the actual any of the actual science. And so it's really, really exciting. And some of our preliminary experiments that we've done and have produced some really, really exciting results. And we're really, really happy to share it with the world. We've also been partnering with the two companies I mentioned, and we will be heading into clinics here, like probably early Q2. We have clinics signed up to pilot the Alice product, and so that will be putting us in some revenue generating territory, which will be really exciting. And yeah, so and we will be continuing to fundraise. So there's that, and then we'll be traveling to various conferences and stuff, and I will be on stage and speaking and doing all of that. So yeah, the 2026 hopefully will be a very, very big year for us. Yeah, launching our babies that we've worked so hard to raise, and hopefully becoming a real revenue generating company. So that's very exciting.
Yeah. Busy year ahead. How big is your team?
So we have a team of 14 staff developers in Addis, Ethiopia. And then my executive and leadership team, there's about another 12 of us. So yeah. And then a lot of my about four of my leadership executive team actually came from the program in Ethiopia that my developers were trained at as well. So it's very, very cool. So I have a very global team. Yeah, we span Europe and both coasts of the United States and Africa. So we're all over the place. So
Yeah, and was this your first time visiting Africa for this event, or?
oh no, this was my third time to Africa. And then I'll be back in I'll be in Ethiopia for the second time next month. So yeah.
Great. Any parting advice for folks that haven't been to Africa in terms of you know, I guess
Oh.
where you'd recommend they go first, and all that jazz?
Well, let's see. Well, I've been to East Africa, so I've been to Ethiopia, now Kenya, and then the only other country I've been to is Mauritius, which some people debate whether or not that's an African country. They certainly think they're an African country, um, but it's in the middle of the Indian Ocean. But my advice would be go to Africa. Um,
Get over there.
it's really it cracks me up. I'm from Orange County, California, and in my other life, I'm you're somewhat typical or OC mom running around with two kids and in those circles, and people look at me like I have three heads with how often I go to Africa now, and they have their preconceived notions of what Africa is, and they're like, oh, well, there's a tech summit, and I'm like, yeah, what do you guys think is going on in Africa?
Yeah,
So
Kenya is very advanced. Like if you're gonna go there, Kenya is beautiful. You've got Mombasa, beaches, Gabon. These places are fully equipped with all the stuff that you need, spas and beautiful restaurants, and yeah, there's all kinds of things. I think there's a big misconception about Africa right now. But I would love to just say this has been an amazing show. I'm so grateful that Beyond the Code has had a chance to really team up with Edge of, and that we've got a guest like yourself who spans the globe. I think, as a fan of the show myself, I love the fact that we get to now talk about Africa together, because I think the global south is something that the majority of these companies are looking at. The other thing also, just for the audience, is that Kennedy's team is mentoring a lot of the young developers that Beyond the Code is capturing in India and in Africa. So right now we've just launched in Chennai, India at the St. Joseph's Institute of Technology. A lot of those kids are learning some of the same technologies that Rejuve.bio are actually using. And so having those developers be a bridge to younger developers is awesome. The same with young developers in Kenya. We've done hackathons and incubators in Kenya, and we use a lot of the same teams. So that's what's really inspiring, is that the guys out of ICOG get a chance to travel and teach, and then they get to see advanced models like Rejuve.bio using that technology. They get to see others that are looking like them actually have, jobs using the technology, building companies. So I think it's super exciting what's happening in the future, and actually in the present moment. So I just want to say thank you, Edge of Show, for giving us this platform and for allowing us to bring in Rejuve.bio and the CEO, Kennedy Schaal, who's a really doll and a good friend of mine and an advisor. So thank you so much.
I mean,
Thank you for following you
yeah,
around
thank
forever.
you. Yeah,
well,
this is awesome.
the pleasure has really been all ours. This is episode 470, and we haven't zoomed in this level of depth on Africa yet. We've covered events all over Asia, all over Europe, South America. We haven't been to Antarctica yet, but we certainly should have been spending some time in Africa. So thanks for sort of catalyzing this series. Really excited to do it with you, Nefertiti. And Kennedy, thank you so much for joining us on the show today. If people want to learn more about you and Rejuve, where should they go next?
You can go to our website is Rejuve.bio. You can connect with me on LinkedIn. You can find me there at Kennedy M. Schaal. I'm pretty easy to find. I think I'm the only person on there with that name. So yeah, you can find me on Instagram at Kennedy 1985. You can find us on X at Rejuve_bio. Yeah, just come find us. You can message me. I'm usually pretty responsive. Um, so yeah, and I love I love mentoring other young startup founders and stuff. It's one of my favorite things to do too. If anybody has questions and stuff about any of the things that I've talked about, whether it's bio related or not, or startup founder related or anything, like I love doing that. So yeah.
Pretty much, it feels like your lab is your second home. That's what I'm.
It is. It is, yeah.
She didn't talk about the fruit flies, but that's the next episode.
Oh yeah. The fruit flies are that's a whole other thing. So those are the longest lived fruit flies on the planet, by the way. So yeah, that's a whole other thing.
All right. That's a good cliffhanger.
Yeah.
Thank you so much for joining us today.
Oh, thank you so much for having me. Yeah, this is great.
We've reached the outer limit at the Edge of Show for today. Thanks for exploring with us. We have room for more adventurers on our starship, so invite your friends and cool strangers to join our journey. If you're among the hundreds of thousands following us on Spotify, iTunes, iHeartRadio, or watching us on Myco or YouTube, please hit that subscribe button, rate us, and make an awesome comment too. And don't forget to pass this episode along to a friend or two who would benefit from it. Doubling back to again, recommend checking out myco.io, where you can watch The Edge of Show and earn for your time and attention. That's myco.io. Don't forget to visit theedgeofshow.com. The is part of the domain name, where you can learn more about collaborating with us and also subscribe to the Edge of Weekly newsletter for the latest Web3 news, events, and show drops. In addition, connect with us on all major social platforms by searching for The Edge of Show. Join the exciting conversations happening online. Lastly, be sure to tune in next time for more great Web3 and AI content. Until then, keep pushing the boundaries. Thanks again for hanging out with us today. The views and opinions expressed on The Edge of Show reflect solely those views and opinions of the show host and its guests. Please make sure to do your own research. Our show is not financial advice. You understand that you are using any and all information on or through this podcast at your own risk. Whenever making financial decisions, we recommend doing your own research and talking to your accountant for financial advice. From time to time, we may feature sponsored content on the show for which we receive value, and we may share links for which we receive a commission if you make a purchase through one of these links. Refer to our website, www.edgeofnft.com, for our full disclaimer, terms and conditions, and privacy policy.